Good morning, my professor. My name is Onyekwe. Today, I'll be presenting two case studies. First, where alprazolam can be used to treat panic attack. And secondly, where alprazolam cannot be used to treat panic attack. Alprazolam belongs to a class of medication called the benzodiazepines. It acts on the brain and spinal cord to produce a calming effect. It is FDA approved for the treatment of anxiety and panic disorder. Side effects of alprazolam include drowsiness, headache, depression, constipation, diarrhea, dry mouth, impaired coordination. Alprazolam has severe drug interaction with carbamazepine, cimetidine, clarithromycin, teraconazole, and St. John's wort. Case study 1 illustrates the use of alprazolam in the treatment of panic attack. I present a 38-year-old African-American female who comes to the clinic for the first time with complaints of panic attack. She was accompanied by her 20-year-old daughter, who is the source of information. Husband died 4 months ago. For chief complaint, patient stated, "My heart is pounding and I feel like I'm going to have a heart attack." History of present illness. Patient's problem started sequel to her husband's death, and she feels guilty and believes her husband's ghost will come back to haunt her. Patient has no psych history and takes no psych medication. However, she takes multivitamins got over the counter. Patient denies current use of illicit drugs, but she stated that she used them when she was in high school many years ago. She has no medical history, but stated that she is allergic to penicillins, peanuts, and pineapples. She denies positive psychiatric history in the family, but stated that her mother uses heroin occasionally. Patient is the last in a family of 3 kids, and she recalls her mother yell at her father during her childhood days. She also stated that she was sexually abused by a maternal uncle when she was 11. EKG and thyroid function tests were negative. Mental status exam. For mental status exam, patient was appropriately dressed. She was shaky and appeared restless during the interview. She does not maintain eye contact, and creating rapport was difficult. Physical examination, there was nothing significant. For case formulation, this is patient's first visit to hospital for panic attack. Her job as an elementary school teacher is disrupted. Although I have emphasized the need for more psychiatric evaluation, the key issue is being able to engage her in a culturally appropriate manner. Her religious belief leaves her in a fear regarding psychiatric disorder. For differential diagnosis, angina, myocardial infarction, cardiac dysarrhythmia, and pulmonary embolism were the differential diagnosis for these patients. A diagnosis of panic attack was made. Treatment plan includes use of alprazolam, 0.25 mg Q8 PO. For case study 2, where alprazolam cannot be used in the treatment of panic attack, I present Ms. B, a 43-year-old African American who is a frequent flyer to the hospital with a complaint of panic attack. Ms. B is a divorcee who lives with her 2 daughters. She lives with her 2 daughters. Patient and her mother are the source of information. For chief complaint, patient stated, "My heart hurts like hell. I find it difficult to breathe." History of present illness. Mother reports that her problem started 4 days ago. When she wakes up multiple times during the night, she complains of severe pain in her leg, her body constantly shaking and shivering. Mother reports that she has been very aggressive to her children and wouldn't eat anything. Past psychiatric history is depression. Past medical history, patient has seizures, gastric ulcer, and acute angle glaucoma. Currently, patient takes escitalopram for depression. She takes carbamazepine for seizures, cimetidine for gastric ulcers, and timolol for glaucoma. She denies substance abuse and is allergic to tramadol and hydrocodone. For family history, mother had depression, while grandmother had bipolar. Patient is the only child of her single mother. Mother had severe depression and could not take care of her. She was brought up by her grandmother who was bipolar. She was sometimes not cared for as a child. Diagnostic tests done was EKG and thyroid function tests, and they were both negative. For mental status assessment, patient was shabbily dressed, restless, and does not maintain eye contact. Assets and liability were none, and physical examination yielded nothing significant. A differential diagnosis of angina, myocardial infarction, cardiac dysarrhythmia, pulmonary embolism were all made, and a diagnosis of panic attack made for this patient. For the treatment plan, sertraline 50 mg PO was given to this patient. Patient was educated on side effects of medication and referred for talk therapy. Alprazolam is indicated in case study 1, but contraindicated in case study 2. This is because patient in case study 2 is on cimetidine and carbamazepine, which has strong drug interaction with alprazolam. In addition, benzodiazepines affect pupillary muscles and may increase intraocular pressure. And since this patient already has glaucoma, a condition characterized by increased intraocular pressure, alprazolam will be contraindicated. The way anxiety and panic attacks are expressed differs from culture to culture. Health disparity among certain ethnic groups leads to poor access to healthcare. Language, idioms of distress, health literacy, and socioeconomic factors such as health insurance or immigration status create barrier to mental health treatment. At the end of this, I gained a lot of knowledge. Firstly, I learned that alprazolam has severe drug reaction with carbamazepine and cimetidine. I also learned that alprazolam cannot be used in patients with acute angle glaucoma. I also learned that selective serotonin reuptake inhibitors like Zoloft will be used to treat panic attack when benzodiazepine is contraindicated. And finally, I did learn that culture and diversity affect our decision-making process for our patients. Here are my references. Thank you for listening.